Be here. We've been traveling the state more now that more people are getting out, and I do have news from President Biden. He sent this specifically for you guys. He said on July 4th, you can meet with 3 people inside your house without your mask on, as long as you don't eat or talk for more than 3 minutes. I think maybe sometimes people in government get a viewpoint that they know what's best for us, when I think most people really know what's best for themselves. In a free country, people make their own healthcare decisions, and I think they actually do pretty well with it. For example, those over 65, 85% of people have been vaccinated. I think without question the vaccine is safer than the disease, particularly over 65. But I also think that we don't have to make blanket sort of statements that everybody has to take it. So for example, if you tell me my newborn needs to take it, I'm like, well, do newborns get sick from this? Well, the death rate under age 25 is about 1 in a million. In fact, you're more likely to have your child struck by lightning than you are to have them die from COVID. So I would think I'd take that with a grain of salt when I'm thinking about it, instead of just blindly saying we got to vaccinate everybody. One of the reasons they're pushing to vaccinate children now is that they're discounting the fact that people who have gotten it naturally have immunity. So about 34 million people got COVID, but even the CDC estimates that there's about 2 people for every 1 that officially got it that also got it. They figured this out by doing antibody testing. So if 3 of you raised your hand and said you've got it, and we tested all your antibodies to see if you had it, there'd probably be 6 more. So it's sort of about 100 million people probably had it naturally, and now we've vaccinated over 200 million. So really the combination of both vaccine and natural immunity has gotten to the point where I think we've reached what they call herd immunity. Why do I say that? Because the daily number has plummeted. I think yesterday there was less than 5,000 cases in the country, and I think there were less than 100 deaths yesterday for the whole country. That's good news. All of this is good news. And so I'm a believer that we shouldn't always just look at things and say, woe is me, how terrible things are, when maybe they're getting better. If you look at the variants, some are worried about, well, what about the Delta variant? If you watch CNN, you can't watch more than about 30 seconds without them saying the Delta variant, the Delta variant. Well, it turns out they've done some large studies now, and the vaccine works for the Delta variant, and so does natural immunity. They both work equally as well. And people say, well, natural immunity, we don't know how long it's going to last. Well, we don't know how long the vaccine is going to last either. But the good news is, when they study this, most people who've had an infection for about 1.5 years still have immunity. People who had the SARS virus, which is a related coronavirus back in 2004, most of them still have immunity 17 years later. Some of the interesting stories that came out of this were people that were still living that lived through the Spanish flu in 1918. I was in Lions Club for many years in Bowling Green. We had a gentleman over 100 years old. And I remember he was one of 10 brothers. He lost his mother during the Spanish flu and half the brothers. So he lost 5 kids during it. It was a very deadly time. But one of the interesting things about the Spanish flu is some of the people are still living that had the Spanish flu. And this is recently, they had to be pretty young. So they had this 107-year-old woman. And this was about 6-8 months ago. She got COVID and she was in the hospital and she was pretty sick. And they went to her daughter, who's like 85, and they said, your mom's got COVID, she's probably not going to make it. And the 85-year-old daughter said, have you met my mother? She survived. But one of the interesting things about Spanish flu is that it conferred lifelong immunity. Now, none of this is an argument for getting it. There's no argument. You don't want to go out and get COVID. But it is an argument that if you had it and you survived, that there are some benefits to having it, the disease, and that we should factor it in. Because if we have already reached herd immunity, maybe we don't have to be so forceful about making children get the vaccine. There's nothing wrong if you decide to do it. If people persuade you that it's in your best interest, by all means do it. But I really think that we ought to think about this, because the burden is a little bit more difficult for our children. So if you're over 65, the death rate from COVID was pretty significant. It may have been a couple thousand out of 1 million. Whereas if you're under 25, it's 1 in a million. So it's a big difference in death rate between older and younger. There's also a risk factor if you're overweight. So I'd say over 40 and overweight, that's a significant risk factor. And you say, well, what are the side effects of the vaccine versus the disease? No question. Overweight and over 40, I do the vaccine. Over 65, I do the vaccine. If you don't want to, though, that's your business, not mine. That's just sort of advice. And that's the way really it ought to work. In a free country, you get advice, you either take it or leave it. That's up to you. But I think the fact that we've reached herd immunity, we shouldn't be so forceful on children, because it is a higher bar. Since the death rate is very, very rare for children, they have to make sure that the vaccine's incredibly safe. Because if you're over 65 and they say, oh, well, there's occasionally a problem with the vaccine, but you have 2,000 chances out of 1,000,000 of dying, almost everybody did. That's why 85% of people over 65 took the vaccine. But I think we're at a point where we're really getting beyond this. I think we are at a point where hopefully it's on its last legs. We're still going to have some of this, but it shouldn't consume us. There are some important things that happened, though, throughout this. And one of the things that happened in the last year is that basically the governor decided that he would make the decisions on how many people could be in a restaurant, hotel, what their hours could be, whether a bar could be opened or closed. He made all these decisions, not with input from the state legislature, he just made them on his own. He did them under what are called emergency powers. Well, the emergency powers were given to the governor, just generically, not this governor, any governor, back in the 1990s. And I think the intent of the legislation was that, if a hurricane, or a tornado hits Lebanon, and you wipe out 100 houses, and you need food and water and shelter, judge executive or somebody calls the National Guard in, and they come in and they help to feed and clothe people and shelter people for a while. But I don't think it was really intended that we would give the governor power enough to just make all the decisions for the economy without any checks and balances from your state representatives or your state senators. It sort of goes against what we in our country, see, the beginning of our country was, and really for 1,000 years even in England, was to limit centralized power, to disperse that power. First it was the barons, then it was expanding parliament, expanding the right to vote, then us saying we didn't want taxation without representation. All of the struggle of maybe almost 2,000 years now, maybe 1,500 years, has been to sort of disrupt central power and have checks and balances, so no one person has all the power. So really what allowing the governor, whether you agreed or disagreed, I think there really needs to be some checks. So the state legislature came back in January. They had to wait 9 months because they're not allowed to call themselves back in session. They came back in session in January and they said, if there's an emergency order from the governor, it expires in 30 days unless we come back in and we vote to affirm it. And that would be some checks and balances between legislature and the governor. And I don't care whether it's a Republican or a Democrat governor. I don't care what party they're from. Republicans may win the next time. I'm still for the checks and balances to make sure that one person doesn't have all the power. Well, they passed the legislation in January, and the governor now is suing the legislature and saying it's unconstitutional for them to take his power away. It was heard before the Supreme Court about 2 weeks ago, and there'll be finally a verdict on this. This is a pretty important decision. The governor's arguing in court that his powers are inherent, that he just has these powers somehow, that, I don't know, God gave him these powers. But he says they're his, and they came to him by some means other than the legislature, and the legislature can't take his powers away from him. Well, that would go against everything about the way sort of our state and our Constitution would work, that there are checks and balances, and the state legislature can vote and control how much power they give to the governor. That's a big deal, and that's going to come out. I think it's important not that we just rehash what happened during the pandemic, but that we know going forward, sort of, what worked, what didn't work, what we should do if this happens again. And there are some real things that I think go to the core of whether you make the decisions or government should tell you the decisions. A couple of these would be originating from my friend Dr. Fauci. Dr. Fauci said originally that no masks work. Well, that wasn't entirely true, because some masks do work. But he said no masks work because he didn't want you to go out and buy the N95 mask. So he thought there'd be a shortage. So he lied to you. He acknowledges that he lied to you, but he did it for your own good because he's smarter than all of us. And so he wanted to protect the N95. He thought there'd be a shortage of them. There wouldn't be enough in the hospital. So he said no masks work. And then he came out and he reversed himself about 3 weeks later and he said all masks work. Well, that's not true either. If you go to the hospital in your community or in any community and there's a patient with COVID and you ask the doctor what kind of mask do they wear when they go in the room, none of them wear their cut-up t-shirt to go in the room. They all wear an N95 mask. If worn properly with gloves and sterile technique, you can, there's still some risk, but you can be around COVID patients. It has to be done very, very precisely, and the cloth masks don't work. So it might be a disservice to you. Let's say you've got somebody sick in your family and you don't want to leave them and you want to be around them. and they have COVID, but you go in their room with a cloth mask, you may be actually encouraged to do things you shouldn't do. So if you have somebody, maybe you should be wearing a N95 mask if you have to take care of them. The other thing he hasn't told us, and this is incredibly important because there still may be somebody in this room who either gets sick or knows somebody who gets sick. There is a treatment, but there's a window of time when you get the treatment. It's called monoclonal antibodies. And you have to get it when you begin coughing. You're getting a little bronchitis, but you're not full of fluid and you don't have full-blown pneumonia yet. There's a 3 or 4 day window. So you can get COVID the first couple of days, you're not that bad, you have a fever, some aches, but then you start coughing, you feel like you got something in your lungs. If you get the monoclonal antibodies, you can be cured. President Trump took them, Chris Christie took them. They both have age as a factor, and what's that other factor they have? Oh, we can't say that. But they have a few extra pounds. And the thing is that those are big risk factors. They both got the monoclonal antibodies and survived. I know people with metastatic cancer who got monoclonal antibodies and survived. So I haven't heard Dr. Fauci once tell you that there's a window of time and if you wait too long. I had a friend who was in his 40s, he was overweight, he got sick, and then he got sicker and sicker and sicker, and when he was unable to be able to breathe again, he went to the hospital. They had to intubate him within 2 hours. He was on the ventilator for 9 days. He survived, but somebody needed to get to him 4 or 5 days earlier and say, if you take the monoclonal antibodies. How good are the monoclonal antibodies? Let's say you're 80 years old and your wife or your husband is sick and you don't want to leave them and there's nobody else to take care of them and you just made the decision you're staying with them. A lot of people do that. People think, oh, a lot of people will take care of their spouse that way. You know what? If your spouse has COVID, they'll give you the monoclonal antibodies. There are studies saying if you give the spouse that's not sick the monoclonal antibodies, they don't get sick. They either don't get it at all, or if they get it, they must get a mild variety. But that study's out there. I haven't heard anybody. Instead, we've got Dr. Fauci saying wear 2 and 3 masks, which don't work. Instead of telling us there is a cure and a treatment, not necessarily a cure, there is a treatment for COVID if you get it soon enough. But the bottom line from my point of view is these are your decisions to make. It's kind of like if you'd asked me last March, you go to a church with 2,000 people, should you go to church in the middle of March? You're 72 years old, should you go to church? I'd probably say no. I think it's probably a risk factor, and I wouldn't go sit in a congregation for 2 hours. But I would never tell you you can't go to church. That is your decision. It's one of the most basic freedoms we have. It's important, really important to a lot of people. And some people, frankly, just make that decision. We're all different. Look, my in-laws are 89, 85. We got them the vaccine as soon as we could. My parents are 85 and a little more stubborn. They wouldn't take it even though we tried to get them to take it. Even though 3 kids are doctors and told them to take it, they said it was none of our business, and they would tell us that they wanted our advice. But they lived a long life, and that's their business. That's what happens in a free society. Not everybody makes the same decision. But it's the one thing about freedom that can allow us all to come together, is we can have a variety of opinions, and you can have yours. In a minute, we're going to hear some maybe from people who have different opinions. That's great. But I'm not trying to make you accept any of my opinions, and you don't try. Somebody said that was one of the worst things that came out of this, was not that government was telling them what to do, but everybody around them seemed to, be a busybody and say, you need to do this for your health care. And it's like, when did we become a society where other people were dictating to us what we do in our own health care? So I think there are things we can learn from this. As far as the economy and jobs, the good news is there are lots and lots of jobs out there. The bad news is right now the government's paying more not to work than to work. If you have 2 unemployed, mother and father and 2 kids, you can get close to $100,000 if you work it right. It's about a little over $600 a week, so it's maybe $32,000, $34,000. You double that for a family, you add in the child credit and the earned income tax credit, you can get close to $100,000, some of the studies are showing. That's a problem, and that's leading to millions of jobs being unfulfilled. Now the governor's still continuing that, but in other states, 25 governors got rid of the extra money they were giving, and guess what? They're doing better than we are. Florida's thriving because they opened up their economy months before we did. The incidence of the disease is about the same in Florida as it was in California. Even though California remains locked down, unless you're the governor and you can go to those fancy restaurants when nobody's looking, although I guess he got caught, somebody was looking at the time. But the thing is the states that stayed locked down are about the same as the states are open. States are open, they're doing better economically though. So we have to think through this because we could get another one of these pandemics. Now, the good thing is I think we'll get a vaccine very quickly if we get another one of these. They also may be able to create the vaccine for the flu much quicker now. It used to be the flu vaccine was guesswork. 1 out of 3 times they got it right, and the other 3 times you were taking something that didn't really work. They didn't ever tell you this, but that's how it's always worked. It's been guesswork. But they may be able to actually target the flu vaccine towards the actual flu that is out there with the new technology we have. So some things good came out of this. We have to learn about whether or not we want to go through economic lockdowns and whether they changed the course. I don't think anything we did changed anything. I think the virus did what it was going to do until we got the vaccine. The only thing that changed this was natural immunity plus the vaccine. We've finally gotten to a point where there's enough immunity that it's slowing down. As far as the things that are going to come in the next 6 months to a year that I'm worried about is we passed out so much money that I think we've diluted the value of your money. So I think you're going to get inflation. You're seeing it now, some at the pump, but restaurant owners and business owners are saying that everything they purchase is going up in prices. It's not just lumber and other things, it's throughout the whole supply chain. Prices are going up. Now, people on TV will tell you this is transitory. This just has to do with backed up supply chain. I think it's more than that. I think it's a matter of printing up trillions of dollars and giving it and passing it out to people, but it's diluting the value of your currency, and so your prices are going to rise. Some of you may remember that from the 70s. When we got inflation, we also got stagnation of the economy. We got stagflation. We had other problems. Japan did this and had a couple decades of this. So we need to be wary of this because that's what's going on now. We're now borrowing trillions more. We did $2 trillion earlier. We're getting ready to talk about another $1 trillion in spending soon. But then there's another bill lurking around that Biden said he won't sign the $1 trillion bill unless he gets another $3 or $4 trillion on top of that. So it's fine to want things, but it's another to do it in a rational way. We all want stuff. We all wish that government would send you a check every month. But the problem is if we did send everybody a check every month for not working and we printed the money up, it destroys the currency, destroys the economy, and really you're borrowing it away from your kids and your grandkids. We all know it inherently. We know you can't get something in life without working for it, and yet that's what the government did. They sent out checks and said, here's your check. You're not allowed to go to work. We're closing your hotel down, closing your restaurant down, but here's a check anyway. Well, that money didn't come from a savings account or a rainy day account. It came out of thin air, and that's the repercussions we're going to have over the next couple of years. I do think that we are a resilient country, though, and we can overcome this. The history of our country is an amazing history. If you go back to like 1820, beginning of the Industrial Revolution, 96% of people in the whole world lived on $2 a day. That's a definition of extreme poverty. Everybody lived that way. There was no obesity because there was no food. The only people that had any kind of food were the royalty. 96% of the rest of us just lived hand to mouth on what we could grow or forage for. Fast forward to when I was born in the 1960s, instead of 96% of people in extreme poverty, it's about a third of the entire world. Fast forward to today, less than 10% of the people live in extreme poverty. The poorest people in our country are like the middle class for a lot of the rest of the world. It's not to say there aren't problems, but to put things in perspective, what an incredible country, what an incredible economic system. And if you say, I just want to help people, I want to help feed people, I want to help feed the world, we're doing it. 25% of our food is exported to the world. What's one thing we do probably better than almost any country in the world? Growing stuff, agriculture. We do a great job. So there's a lot of good things about this country. We need to understand where the wealth came from. We can't think that, oh, well, maybe we should experiment with socialism. My wife and I wrote a book a year or two ago called The Case Against Socialism, and in it we open with the story of Venezuela. Venezuela has more oil than Saudi Arabia, but they're now eating their pets for food. They have 1,000-fold inflation every month. We open the book with a story of a 16-year-old girl, and she's in a gang, and the territory they have is 4 dumpsters for restaurants, and they guard these dumpsters for the scraps of food that come out. They have more oil than Saudi Arabia, but socialism destroyed their country. We need to make sure that we're proud of what made our country great. Capitalism is the freedom to trade, the freedom to sell your services and wares, the freedom to be largely free of excessive government regulation, and to reap the return of how hard you work. The harder you work, the more you get. For you and your family, but also for your community. Let's say I want to start a business, I want to make a lot of money in Lebanon, but I hire 1,000 people. It's good for everybody. It's not just good for me, but I do it because I want stuff for my family. That's the self-incentive model that has allowed so much wealth to be created. But I've hoped for us, both as a state and a country. I enjoy being in the mix of the battle, And I'm going to keep fighting, and I appreciate your support. Thank you.